So, good morning po sir. I-discuss po namin ngayon ni Dwayne yung types of wounds and procedures in controlling infection. So, first po, define po muna natin yung wounds. A wound is an injury to living tissue caused by a cut, blow, or other impact, typically one in which the skin is cut or broken. And now we'll talk about open wounds. An open wound is an injury involving an external or internal break in body tissue, usually involving the skin. Nearly everyone will experience an open wound at some point in their life. Most open wounds are minor and can be treated at home.
First is abrasion. An abrasion occurs when your skin rubs or scrapes against a rough or hard surface. Road rash is an example of an abrasion. There's usually not a lot of bleeding, but the wound needs to be scrubbed and cleaned to avoid the infection. The second open wound we have is laceration. A laceration is a deep cut or tearing of your skin. Accidents with knives, tools, and machinery are frequent causes of lacerations. In the case of deep lacerations, bleeding can be rapid and extensive. Next, we have puncture. A puncture is a small hole caused by a long, pointy object, such as a nail or needle. Sometimes, a bullet can cause a puncture wound. Punctures may not bleed much, but these wounds can be deep enough to damage internal organs. If you have even a small puncture wound, visit your doctor to get a tetanus shot and prevent it. Lastly, we have avulsion. An avulsion is a partial or complete tearing away of skin and the tissue beneath it. Avulsions usually occur during violent accidents, such as body-crushing accidents, explosions, and gunshots. They bleed heavily and rapidly. Closed wounds are usually caused by direct blunt trauma sustained when falling down or in motor vehicle accidents. Even with the skin intact, the damage can reach down to the underlying muscle, internal organs, and even the bones. Major type of closed wound injuries. So first we have contusions. Contusions are a common type of sports injury where a direct blunt trauma can damage the small blood vessels and capillaries, muscles, and underlying tissue, as well as the internal organs and, in some cases, the bones. Next, we have hematomas. Hematomas include any injury that damages the small blood vessels and capillaries, resulting in blood collecting and pooling in a limited space. Hematomas typically present as a painful, spongy, rubbery lump-like lesion. We have crush injuries. Crush injuries are usually caused by an external high-pressure force that squeezes part of the body between two surfaces. The degree of an injury and pain can range from a minor bruise to a complete destruction of the crushed area of the body, depending on the site, size, duration, and power of the trauma.
In addition, wounds need special treatment. This depends on their size and how severe they are. Professional help is needed if the injury is large and severe, and if the patient already has fever, he or she has to stay in bed at home. So we always need to clean our wounds to prevent bacteria from going inside and create more infection. In controlling infection, a caregiver or a person attending to an injured patient should know how to recognize and treat an infected wound. Usually, wounds that are infected are swelling and becoming red. It may develop pain and pus discharge. The person with an infected wound may also develop fever and swelling of the lymph node. The area of the wound must be cleaned, washed, and covered with a dressing. The dressing should be good enough to prevent bacteria in entering the wound. It should be porous to allow sweat to evaporate. Otherwise, the skin will become moist and bacteria will increase in number. First procedure is sterilizing equipment. Bacteria can be destroyed by boiling, fire, radiation, chemical disinfection, and/or steam under pressure. After this procedure, when the bacteria have been destroyed, the equipment can now be used safely. So we should always sterilize our equipment before using it to prevent more bacteria entering the wound. The next procedure is using an antiseptic technique when applying dressings. A caregiver should observe some precautions whenever dressing a wound to avoid contamination from microorganisms. If the room is to be cleaned, dust the room at least 1 hour before applying the dressings to allow air time to settle. Applying dressing depends on the size and the position of the wound and what equipment is available for use. In case of larger wounds, the caregiver has to assist the doctor or nurse who will provide larger dressing and the necessary sterile equipment in dressing the wound.